Welcome back, everyone. Some COVID-19 patients say they're experiencing tinnitus or ringing in the ears after getting the virus. In fact, just last week, the CEO of Texas Roadhouse committed suicide after claiming his post-COVID tinnitus had become unbearable. Western Mass News reporter Lexi Oliver is getting answers on how this side effect is impacting people's lives.
It's pretty distracting. I can't figure out anything to make it go away.
Maura Ford is a nurse practitioner in Springfield. She tells Western Mass News she's been struggling with tinnitus ever since she had COVID-19 back in November.
It's been like every day. Everything else went away, the fever, the headaches, but I still have tinnitus and it's a little disorienting.
Tinnitus is a sensation of ringing in your ears, similar to what you're hearing right now. Now imagine how irritating that would be to hear every day. Ford says she only experiences brief episodes, but it's worse for others.
If this is persistent, it can really drive one crazy.
The family of CEO of Texas Roadhouse, Kent Taylor, has said publicly that he struggled with severe post-COVID tinnitus, and it had become unbearable in the days before he took his own life last Thursday.
It can really impair someone's functioning. If you're a high level or really a very functional individual, very active, and you start having this symptom, I can really see someone being depressed and anxious about this particular symptom. So it can be debilitating.
Dr. Armando Paez, chief of infectious diseases at Bay State Medical Center, says quarantine and isolation can make this worse because the ringing is much more noticeable in a quiet room and there aren't as many distractions. He says studies done by the University of Manchester found an association between COVID-19 and hearing problems. Researchers estimate about 8% of people experience hearing loss, about 15% tinnitus, and about 7% vertigo. Dr. Paez says as of right now, this is just an association and more research is needed. Western Mass News spoke to others who say they experienced tinnitus after receiving their COVID shot, something Dr. Paez says is possible, but experts don't currently see a direct link.
When they report these side effects that may be temporarily associated with the vaccination, they look at, okay, is this a signal that is related to the vaccine?
Which is why he recommends patients report any side effects to the Vaccine Adverse Event Reporting System created by the Centers for Disease Control and Prevention. That way, experts can determine whether there's actually a pattern. But Ford says she doesn't think this should be a reason not to get the vaccine.
I would still get it because I think the side effects of COVID are far worse.
For Western Mass News, I'm Lexi Oliver.